Hello, and welcome to Ask the Cannabis Doctor. I came to discover the power of cannabis after years and years of searching for relief. We're here to answer all your questions so that you can be empowered to take charge of your health. Our hope is that what was my medication of last resort will be your first. Cannabis really is one of nature's superfoods, right, Dr. Fry?
It's nature's pharmacy in a flower.
Back pain is the third most common reason for visits to the doctor's office. It's also the single leading cause of disability worldwide. But get this, it's also one of the top 5 conditions that cannabis can effectively and safely treat. So time to throw out the opiates, right, Dr. Fry?
That's right, Pamela. Opioids are great for acute pain or for short-term pain relief, but for chronic pain, cannabis is so much safer.
And this is huge, considering that every day more than 130 people die in the United States from overdosing on opioids, the prescription drugs that are meant to relieve the chronic pain. So something's got to give.
In 2017, more than 47,000 Americans died as a result of an opioid overdose, and an estimated 1.7 million people in the United States suffered from substance use disorders related to prescription opioid pain relievers.
So chronic back pain is a major issue. Why is that?
Well, the back is a complicated structure. It has bones, joints, ligaments, and muscles, and you can sprain ligaments or muscles, rupture a disc, all of which could lead to back pain. Now, obviously, sports injuries and accidents are one thing, but more often, it's the simplest of movements. For example, bending over to pick a pencil up off the floor can have painful results. In addition, arthritis, poor posture, obesity, psychological stress, anxiety, depression can all cause or complicate back pain. And what is truly remarkable about cannabis medicine is that it's been known to help not only the pain, but a lot of the conditions that cause pain. But here's the thing, the key to effectively using cannabis medicine for back pain is knowing the source of your back pain.
So today we're going to cover topics such as, can cannabis effectively treat acute and chronic back pain? Is marijuana an appropriate replacement for opioids? And can cannabis be an effective treatment for opioid addiction? We've received hundreds of questions for the Cannabis Doctor on the subject of cannabis and back pain, and we've narrowed them down to the 5 most frequently asked.
But first, let's take a look at how consuming cannabis can help relieve your back pain. Our bodies have a system called the endocannabinoid system, and it consists of millions of receptors that are found throughout the body, and they are activated by compounds that our bodies make called endocannabinoids. And the purpose of this system is to create balance, or what we call homeostasis. And when the system isn't working up to par, we can add compounds from the cannabis plant. We call them phytocannabinoids, and they help improve the function of our endocannabinoid system. And this system can make adjustments to our inflammatory response, it can stop pain signals, it can adjust our mood, it regulates muscle tone, it helps us sleep, it improves our appetite, and the endocannabinoid system with these endocannabinoids and the phytocannabinoids can really help relieve a lot of the conditions that cause chronic pain. The most understood of the compounds our bodies make are anandamide and another compound called 2-arachidonoglycerol, which we fondly call 2-AG. And these are the 2 most studied. In the plant, there are over 150 compounds that are particular to the cannabis plant, and these are called phytocannabinoids. And the ones that we've studied the most are THC and CBD. And all of these cannabinoids are what we call psychoactive because they can affect things like anxiety and stress and depression, but only THC is intoxicating. The endocannabinoid system can shut down that pain signal, it can reduce inflammation, it can relax our muscles, and it can also take our mind off of discomfort so that sometimes we don't get rid of pain completely, but when we use cannabis, it just doesn't bother us.
Great. Now that we have that foundation, let's move to our audience questions. Dr. Fry, I currently take oxycodone for my back pain. Is it okay to mix marijuana with other medications?
That's a good question. There's some medications that should be spaced apart from cannabis because of drug interference, but with opioids, it's perfectly fine to use cannabis. Cannabis actually potentiates the pain-relieving effect of the opioid without increasing the risk of side effects like respiratory depression. So most patients who use cannabis and opioids together find that a much smaller dose of opioid will relieve their pain and actually may do even a better job.
Dr. Fry, why does my back pain seem to shoot down my leg, and can cannabis help?
Well, there are a number of things that can cause back pain. One is neuropathy. If you have a nerve impingement, you can have radiating pain or tingling, numbness, or weakness in your leg or arm or fingers, toes, and that's something that should be evaluated. But cannabis can help with neuropathy or neuropathic pain. Other things that can cause pain are inflammation and muscle spasm, and we treat them differently. Neuropathy and inflammation can be treated by taking something internally, like a tincture, or even with inhalation or a sublingual tablet. Muscle spasm can cause back pain. It tends not to radiate, and sometimes muscle spasm will respond to a topical application like a salve or a balm that can be massaged into the muscle. So if you're not sure what's going on with your back pain, it's very important to seek medical attention.
Dr. Fry, I recently picked up my baby and tweaked my back. I'm using a cannabis topical, but it's not working. What am I doing wrong?
Well, unless the back pain is due to muscle spasm, I would not anticipate that a topical would work. Topicals just don't get deep enough into the body to get into the bloodstream to address things like neuropathy or inflammation. They work best for muscle spasm or for joint pain like knees, ankles, elbows, shoulders. So you should get your back evaluated if it's been going on for some time, but a tincture or sublingual tablet, something that can be absorbed into the system and get into the bloodstream would be a more appropriate mode of delivery.
Dr. Fry, my dad suffers from arthritis, but he's open to trying cannabis, but he is worried about being high all day. What can I tell him?
Well, you can explain to your dad that arthritis is from inflammatory pain, and CBD, which is not intoxicating, is an excellent pain reliever for both inflammatory and neuropathic pain. Now, CBD and THC work better together than either one by themselves, but you don't need much THC in there. So I would recommend him trying something that's a CBD dominant product, either a tincture or a gummy or a capsule, or even trying a topical. Topical salves work really well for joint pain, and if it's not arthritis in the back, but one of his extremities, like his knees or his elbows or wrists or shoulders, using a topical salve or balm can be very effective. So by using a tincture or other form of oral consumption in addition to a topical, your dad will be able to treat that inflammatory response and relieve his pain, not only from the outside in, but the inside out.
Dr. Fry, I've been on Norco for over a year for my back pain, and I'd like to switch to cannabis. Is it going to be strong enough?
Well, it may not be about being strong enough, but certainly cannabis could possibly help. Opioids, and Norco is one of them, are really meant to be used short term, and they don't address other problems like inflammation and neuropathy. They only are there to interrupt the pain signal. By adding cannabis to your medication, you could actually help that Norco work better. Norco or other opioids can lose their effectiveness as we become accustomed to them. The other problem is that when we're on opioids for a long time, they can actually increase our sensitivity to pain, and it's a condition called opioid-induced hyperalgesia. So by adding cannabis, there's crosstalk with the opioid receptors, and this potentiates the pain-relieving effect of the opioid without increasing the risk of any adverse effect like respiratory depression. My patients usually add cannabis and experience decreased pain, and that can be even after we decrease the opioid dose by 50 to 75%. So a lower dose addresses the tolerance that we've built up, and it helps reduce that opioid-induced hyperalgesia. But when weaning opioids, it's really important to do it slowly and under medical supervision. For instance, I have a patient that I started seeing who had 4 years of excruciating pain. He had a spinal cord injury and is in a wheelchair. He had been on a number of opioids and was experiencing a lot of adverse effects from it while still being in significant pain. He had anxiety, he was depressed, he couldn't sleep, and the opioids caused excruciating constipation, and he was very unhappy. So we started a cannabis regimen for him, and almost immediately his pain improved. And that was with dialing back his opioid doses by 50% or so. Over the next few months, we were even able to decrease his opioids and other medications to the point that he was not taking nearly the doses that he had been on prior and was feeling much better. And by doing so, we relieved his pain, and we also were able to eliminate those adverse effects from taking opioids over a long period of time. Currently, he's much happier. He still has some pain. He's off of all opioids, and by the way, he's off of all the other medications that he was taking for his anxiety and depression and constipation and muscle spasm, and he and the family are so much happier. Now, everyone has a different endocannabinoid system, and so we all respond to cannabis a little bit differently. And how this patient responded may not be the way every patient responds, but it's certainly worth trying cannabis, seeing how it helps, seeing if you can reduce those opioid doses and start to feel better.
What an amazing story, Dr. Fry. I really believe that cannabis could potentially be a solution to America's opioid epidemic. And I just want to thank you once again for being so informative.
It's my pleasure, Pamela. And if you have questions you'd like to ask on future episodes, please send them to askthecannabisdoctor@hellomd.com.
When it comes to pain management, these are my current hemp-derived CBD go-to products. I'm really loving this Plant People's, it's basically a topical balm. It has a lot of CBD in it, it's full of essential oils, and I just like the feeling of it on my skin. It's got that sense that you've gone to a spa but you haven't. I also really enjoy Cured's full-spectrum hemp oil tincture. When I was on the John Muir Trail and hiking 211 miles, I actually felt quite a bit of pain, whether it was in my feet or my hips or my lower back, and I would take this tincture twice a day. And I think if you were to ever look inside a bag I'm carrying, you'll find Mr. Moxie's mints. I really like to have mints because who doesn't like to have fresh breath? And they're full of CBD, so if I forget to take my tincture, I always have a mint as a backup. Thank you for watching Ask the Cannabis Doctor. We hope you enjoyed this episode about cannabis and back pain. If you'd like to speak with one of our knowledgeable cannabis-trained MDs, please visit hellomd.com, where you'll also find articles, videos, testimonials, and a curated array of lab-tested products. You can also watch these episodes and more on the new HelloMD app. So see you next time on Ask the Cannabis Doctor.